No doubt a lot of questions here in Toronto and the GTHA as a result of what the province has announced today. But Mayor John Tory and Dr. Eileen de Villa said, while we all want to restart in this region as well, there are reasons for not getting there yet.
The bottom line is that the reopening and the restart are happening, that we are working well with the Government of Ontario to make sure it happens in this region on a basis consistent with public health and on the assumption that everyone is ready.
COVID-19 does not impact all communities in the same way. We need to keep looking at our own unique local circumstances to inform our approach for safely reopening. The plan to reopen should be gradual and based on what is happening in our city.
Now, there is some relatively good news, some hope in the form of city day camps, splash pads and swimming pools will be coming soon. Add the Camp TO and Swim TO programs to all plans ending with TO that have been announced. Details on timelines for opening and distancing rules are to be announced later this week. Now, here's your latest numbers. Toronto has reported a total of 12,707 cases of COVID-19. That's an increase of 169 at this point. 9,746 have now recovered. That's up 123. And 944 people in the city have now died. Also today, Toronto's Board of Health met and unanimously decided to recognize anti-black racism in the city as a public health crisis. Chair Joe Cressy says much needs to be done in the system with preventative measures being put in place rather than continuing to just respond to emergencies.
This is a public health crisis. Anti-black racism is also about public health. And so just as we spend far too much money as governments on emergency services and emergency rooms, we need to spend more money addressing the root causes that put people in those rooms in the first place. We need to deal with housing inequities, poverty, and until you do that, we're never going to be able to tackle anti-black racism.
Dr. Eileen de Villa also confirming that the latest new cases of COVID-19 in the city are coming from a younger demographic. However, she doesn't want to speculate why that is at this point until further investigation takes place.